In this video, you'll be able to see how we can easily and reproducibly perform a DMEK graft. This is a vacuum 3 fine, and we just use it for the holding the transplant in the way we want to have it. This is a ton dissector, which is a two-sided instrument, and with one we just gently hold the hand and rotate the transplant. So this is the most accurate way how to perform slight cut of the decimates just in front of the trabecular meshwork. Now we are turning the instrument and we use a trypan blue to dye the decimates membrane, or the back part of the decimates membrane, or the part where there is no more decimates membrane. Actually, decimates membrane, the endothelium, doesn't dye with this color, so we can see just back. We can color the back side of the plate, or we can color the tissue where there is no decimates anymore. This is an unedited video from beginning to the end. Now we are just trying to partly dissect the decimates and the rest of the stroma. So we just find a place where we are able to go safely under the decimates, and as we are there, we just rotate the transplant, as you will see here. I'm left-handed, and my instrument is just being held with the left hand. This video will take about 10 minutes, but you see that because it's unedited, and here you see that I'm just holding my left hand or the dissector in one position, and I'm rotating the graft. I think it's very similar as when we are loading the ICL. We are progressing with the cartridge, not with the instrument holding the lens. And here also we have to do a 360-degree separation of the lamella, or of the decimates membrane with endothelium. There are other ways which I will show in the other videos, like a hydrodissection. But for me, this is the most reproducible way, and in this way I don't lose any tissue. It's nearly 100% doable. This is a relative young donor, 55 years. We are doing also a younger donors in the similar way. So now the 360-degree separation was done, and we are just using a technique where it's called so-called scuba technique. You hear here I'm just moving or removing the parts where there are slight tears in the decimate. I mark it again with the trypan blue to see if there are any tears that would propagate. And if there are no tears, what we have established with a very nice gentle 300 degrees cutting of the endothelium, just a little bit in front of the trabecular meshwork. Here the denuded portion is being colored, and we can exactly see where the edge of the estimates is, and if there are some tears, they're being removed so that we have a continuous axis of the decimates. And we are starting pulling away the decimates. As I already told you, this is a unedited, and I want to show you that we need about 10 minutes to do that. And if there is a skilled personnel, they can do it even quicker. So we are using the scuba technique, giving aerosol on top of the endothelium, trying to grasp the decimates and pull slowly, and watch carefully both sides, left and right, if this is preparing as it should be, that there would be no tear. If some tear starts at the periphery, we have to stop and finish this tear to the periphery. So we do this maneuver 4 times, and every time we take out the liquid so that the endothelium or the decimates lies or goes back into its first position, primary position. This, I think, is the less possible trauma for the endothelium. Again, we've turned it 90 degrees, grasp it at the periphery, and slowly detach it. And again, look at the edges carefully, not to propagate any starting tear. And taking a suji and bringing the liquid out from behind the decimates, so that decimates slides back into its place. This is a transplant that we are going to use for DALK surgery. The DALK patient is now on the table waiting for this transplant. The removing of the stroma was already done, and the decimates will be used for a second patient. So 1 cornea for 2 patients. Again, this is the 3rd quadrant. We don't go over the center of the attached decimates, and leave some attachment in the center. If we use cornea just for decimates, then we do just partial thickness, and in this case, since we are using also the front part of the cornea for the DALK surgery, we are going to do a penetration or total penetration of the cut, or total cut through the whole thickness of the cornea. Again, some aerosol is brought, so we storage our corneas in aerosol at 4 degrees. And now the 4th quadrant is lifted. And again, the fluid is taken out. And this cornea is now ready for trephination. Now we will apply just a little bit of suction so that the centration of the cornea will be stable. We just did a 1/4 of the syringe so that it doesn't change the graft, but it sticks a little bit into the punch. This is the first time we apply the vacuum, and now the full thickness trepanation will be performed because we use this graft for 2 cases. It was nice trepanation. And now we will store the decimus membrane in a separate container with aerosol, and we will go on with the surgery of a DALK. In the whole procedure, the transplant is touched just once. This is when we are pulling it off of the cornea, then we put it into the trypan blue for 20 seconds and put it into the shooter or into the cartridge, 1.8 millimeter cartridge. This happens if we have problems with the instrument, if we don't have the best instruments. If I squeeze this instrument too much, it opens in front, and therefore I had to release the transplant, and I will just go on with this again. So I'm grasping again and getting it free. It is a very small roll that we are going to transplant.